Hello, everybody. My name is Jim Austin. I'm the Chief Executive at Derbyshire Community Health Services, but also one of those people trying to lead the work on neighbourhood working. And I'm joined today by...
Hi, everybody. I'm Dr. Penny Blackwell. I am a GP in the Derbyshire Dales. I'm also the Chair and Clinical Director for Neighbourhood Care, working for Derby and Derbyshire ICB. So, Jim, we spent a whole day yesterday at the Neighbourhood Summit, didn't we? This was an event with partners from across Derby and Derbyshire. Could you give us a bit of background to that event and how it all came about?
Sure. So, well, as an NHS and broader system, we've been talking about integration for over 20 years in its various forms and formats. And most recently, Lord Darcy's review talked about three big shifts and changes that the NHS needed to make, one of which was from acute to community. At the same time, a few months ago, the government issued their guidelines on how we should be forming up to work at a neighbourhood level. And so yesterday's summit was to try and bring together those partners, which, voluntary sector, local authority, general practice, the acute trusts, community, mental health. We had education, we had all sorts of representatives there, 120 people. And we were there to bring our thoughts to a head. And so actually, Penny, tell me how you think the day played out, and did it meet your expectations?
Yeah, I think it did. Thanks, Jim. We did have a really wide-ranging group of people at the summit. And what was incredible, we had at least 120 plus people in the room, and everybody stayed really engaged, lots of energy in the room all the way through till the end of the day, which really feel pleased about. And I think it did meet our expectations, because the expectations were partly transmitting information, seeing where we had got our place model to, and where we got moved into our new neighbourhood working. But also the intent was for us to listen, to critique, to support, to challenge, and there was lots of challenge and ideas in the room. And I think that was really important. So the idea was to listen to that. What I'm really looking forward to now, we've captured a lot of that, and there'll still be some to capture, I think, particularly as people go away and reflect on the day, is to try and carefully review all of that information and try and acting on all of that really helpful feedback from our partners across the system, because I think that's going to make it richer and much more appropriate for what Derby and Derbyshire needs, that for those people who work in Derby and Derbyshire, but also those people who live in Derby and Derbyshire. So there's something about co-producing there as well. So yeah, more than met our expectations, I think. I guess, what are the next steps and timelines from here, Jim? What are we planning to do next, I think, is where we go now.
So I think you've alluded to the first one. The immediate piece is to make sure that we collate all that really useful feedback that we got yesterday. In principle, we talked about principles, we talked about structures, we talked about who's going to be doing what and where. We need to adjust those given the feedback that we've got, and we're going to take that over the next week or so. Sure. We also talked at the end of the session around the community transformation programme. Big piece of work. Significant opportunity to improve the flow through our acute hospitals and broadly out into the community as well, which will really improve things for citizens and save us money. So we're going to be talking about that and sharing that with partners. And then finally, there was something around those 120 people, 120 plus people in the room, taking a bit of collective ownership about how we take not only the neighbourhood working forward, but the community transformation programme forward. And I think, we'll be surveying them, but it wouldn't surprise me if we don't get together again in the next 4 or 5 months, maybe sooner than that, to check on progress and also finally agree exactly how we're going to work.
Yeah, I think that's really important, isn't it? So actually feeding back from when we've reviewed their comments and their challenges and their support areas, but also making sure that we do something like that again, because it'll only be by meeting with each other and meeting with residents who live in Derby and Derbyshire that we actually make this the right way forward. So I think that's a really good thing to commit to. Really want to say thank you to everybody who helped not only shape the day but also run the actual summit itself. And at this point I'd particularly like to reference Nikki Doherty, who did a lot of the thinking with yourself and myself, didn't she, Jim, around preparing for the day of the summit and much of the content of where we've got things to. So thank you to Nikki, who couldn't be with us yesterday. Who else is it to thank?
Well, definitely Sean Thornton, who did a lot of the comms work and preparation for the team. Yes. But frankly, 120 plus people coming. Thank you to all of them that came, because they made the day.
Hugely. Thank you, Jim.
Thank you, Penny.